Let's get started. Welcome, everyone. I'm Dr. Charles Elder. I'm the Executive Director of the Fellowship in Integrative Medicine and Ayurveda at MIU. And it's really a pleasure to see you here today to talk about Ayurveda, Integrative Medicine, and our groundbreaking fellowship program. What we'll do tonight is we're here to tell you about the fellowship, an outstanding training opportunity for physicians and other licensed healthcare practitioners. And we're also here to talk about chronic disorders, the subject of the discussion, integrative Ayurvedic approach to chronic disorders, an overview. And we all know that chronic disorders are an important public health and clinical issue. And our fellowship gives you great new set of tools, a great old set of tools, in fact, that you can practically integrate into your practice to help reinvigorate your practice and to help reinvigorate the health of your patients. So what we're going to do tonight is we'll start off talking about chronic disorders and the integrative Ayurvedic approach, and then we'll talk more about the fellowship, how it's structured, and the type of training that you can expect for those of you who might be interested in the fellowship. So we'll talk, there'll be a number of us, faculty, who will talk, and then there'll be plenty of time for questions and answers. So when we talk about the Vedic approach to chronic disorders, the conversation comes up, and often you'll hear people say, the root cause of all disease is pragya parad, the mistake of the intellect. That is to say, consciousness is the basis of all disease, chronic disease, and of maintaining chronic health. And at other times, you'll hear people say, in Ayurveda, good health and good digestion are synonymous. That is to say, that staying healthy, managing chronic disease is all about digestion and detoxification. And at other times, you'll hear us say that the Vedic approach to maintaining health and preventing chronic disease is all about the proper use of the senses, that the cause of chronic disease is overuse, misuse, or underuse of the senses. So what we're going to do tonight is we're going to take a snapshot at each of those three perspectives, and then we'll come back around and loop it, tie it all together, and learn about some diagnostic tools that we use in Ayurveda, pulse diagnosis, that allow us to detect imbalances before they manifest as chronic disease. So we'll start off with the approach to consciousness, and I'll ask my colleague, Dr. Shankari Wegman, to talk about that.
Good evening, good day, wherever you might be watching this. It's an honor and pleasure to speak with all of you. My name is Shankari Wegman, and it is a joy to be part of the fellowship team. And what I'll be sharing with you is a little bit about the approach to chronic disease from the understanding of consciousness. And I'll just start with sharing my PowerPoint here. And in this understanding of this consciousness approach to chronic disease, let's just start with just the basics of this word chronic. We know it means long lasting, and that it's long lasting, meaning over a year. It's requiring ongoing medical attention, ongoing medical care, and it can also lead to a limitation in daily activities. So that is one understanding of this word chronic. And this word disease comes from the Old French, where it literally is translated as lack of ease or lack of comfort. And according to the National Institute of Healthcare Management, NIHCM, which has a foundation of chronic disease, it's showing that it's the leading cause of illness, death, and disability in the US, with approximately 6 out of 10 Americans living with at least one chronic disease. So that is huge. And chronic disease also makes up about 8 out of 10 of the leading causes of death in the US. Then these include, as you can see in this infographic: heart disease, cancer, chronic lower respiratory diseases, Alzheimer's, diabetes, stroke. So a wide range. And this has a huge impact on the healthcare system. About 90% of the 4.5 trillion that was spent on healthcare in 2022 was for individuals with chronic physical and mental health conditions. And this is also something you can see increases with time and with age. And there's a kind of an estimate of the trend that by 2050, that this impact on the healthcare system can be up to, $2 trillion. That's amazing. Many individuals who have a chronic disease, they actually experience multiple chronic diseases, and there's a impact to the healthcare system with those who are also having multiple chronic conditions, and they represent about 64% of all clinician visits, 70% of inpatient stays, 83% of all prescriptions, and 93% of Medicare spending. And this is a huge impact in that way as well, that one individual may have multiple chronic diseases. So this can seem almost as if this one person, if we think of it, this one person as a tree, that if they're having multiple chronic diseases, such as, say, heart disease, they might have cancer, diabetes, or Alzheimer's, that they are not connected, that each of these different diseases require their own medical management, and there isn't a connection underlying that. From the consciousness paradigm for chronic disease, it traces all disease and disorder to a single underlying cause, which is the loss of connection with the body's inner intelligence. And this is what's really giving rise to any imbalance in the mind or the body. And as that imbalance grows, it can express itself as sickness or disease. So the most effective way, if there's a loss of connection with that inner intelligence, the most effective way is to go to the root and enliven nature's inner intelligence within the body. This is what's creating that ideal state of integration, the ideal state of health, the ideal state of balance in terms of its expression as health and well-being. It's through that enlivenment of the inner intelligence. And this is a holistic approach that really takes care of all the different values that help support health and well-being. So we can see in terms of this consciousness approach that enlivenment of the inner intelligence is one of the basic features. And along with that, we also have that it's prevention oriented, preventing something before it arises. So really addressing all different values of prevention and lifestyle management to make sure that nothing gets deep rooted and then expressing itself as some imbalance. It's also taking into account that all the different lifestyle factors are addressed, and also that any kind of environmental influence coming into the physiology are addressed. And in this way, it's very cost effective in the long run. When we're talking about this value of the inner intelligence, it's really addressing the root. The underlying root is this field of the inner intelligence, or really that source, which we can say is consciousness. So the inner intelligence is the source of the outer expression of the physiology, which is that connection between the source and its expression. And if that connection is not lively, that's how dis-ease can happen, because there's that loss of ease with that connection of that field of consciousness. And this is really the approach. So we see that even in terms of science with physics. This theory of the unified field states that there appears to be a single universal unified field at the basis of all forms and all phenomena in the universe. And as you go into these refined states of matter, you can see at the foundation, there is a field where all the forces, all particles of nature are united as one. And this really shows that interconnection with us and also with the universe around us, with the environment around us. And this unified field, really, we can understand this as the unified field of consciousness. This is that foundation. And this is something that is also something that we can experience. And this is that basis of that enlivening of that field of that inner intelligence. It's a state that's accessible through the practice like transcendental meditation, which really allows individuals to experience their own true self. Transcendental meditation, or TM, is about transcending or settling from the active mind to the silent mind. And unlike other meditation techniques, it's effortless, it requires no control or contemplation. And it's really not allowing, the mind is not on an active waking level. Rather, TM is about transcending, or transcending meaning going beyond activity, systematically settling the active mind to that experience of the silent mind, a state of transcendental consciousness. And this is really likened, if we think of the ocean, it's likened to the calm and quiet depths of the ocean beyond the activity of the waves, or we can say the surface level of the mind. So as the mind settles, the body becomes deeply rested. And this is indicated by so many different physiological stress markers that are reduced. And TM meditators typically experience so many different markers, such as the slowing of the breath, increased brainwave coherence. All of these are just the experience of this deep level of rest that is experienced, a state of restful alertness. This inner experience of restful alertness translates as a huge reduction of stress. And stress is, one of the leading causes of all different values of dis-ease. And this has a huge effect. If stress is reduced at this deep level, has a huge effect on mental and physical health. And over the past 50 years, there have been over 600 studies on TM, making it one of the most widely researched meditation techniques that have been conducted all over the world in over 250 institutions. And what has been seen is that there's a huge effect that happens to the mind and body when this experience of restful alertness is predominant in the physiology and in the mind. So there can see it in autonomic stability, reduced cortisol, decreased anxiety, lowering of high cholesterol, decreased hospitalization, decreased blood pressure are some of the many examples. And the American Heart Association also has reported that the TM technique is the only meditation practice to show that lowering of blood pressure, leading to a reduced rate in death, heart attack, stroke, which is, that link to chronic diseases as well. And this understanding is really, of all of these different markers of stress reduction, is really just this experience of wholeness at that fundamental field of consciousness. So if there's any disconnection from wholeness, this is that loss of ease. Health has its roots, the etymology has its roots in this word hal, which means whole. So wholeness is really the experience of health, and the connection to wholeness is what is providing that ease. This is really the foundation of integrative medicine. Some of the principles, the defining principles of integrative medicine. One is that the patient and the practitioner are partners in the healing process, that all factors that influence health, wellness, and disease are taken into consideration: mind, body, spirit, and also that there is a full use of all the different approaches from conventional complementary methods that is really facilitating the body's innate healing response. That innate healing response is really that enlivening of the inner intelligence of the physiology. These concepts of integrative medicine, these fundamental defining principles, are extremely similar. The origin is really in Ayurveda. As Dr. Charles had mentioned, Ayurveda is a system of healthcare, and it's over 5,000 years old. And the emphasis in Ayurveda has always been one on whole person care. And for whole healthcare, medicine must address all levels. And from Ayurveda, all of these levels of consciousness, mind, and body are something that have to be addressed and maintained for that experience of wholeness, of health, and well-being. And, this understanding of this consciousness approach to Ayurveda, we can see this in, if we look at an iceberg, we see something on the surface, but very, underneath the ocean, there's so much more. So we can understand there's that surface experience. We see the body, the physiology, and just, slightly submerged, we see the mind. But underlying that is this field of consciousness, this experience of wholeness that is there. And this is something that Ayurveda understands and incorporates in all of its approaches. That's why we call it this integrative Ayurveda, because the approach is through enlivening that experience of wholeness, enlivening that connection to one's own inner intelligence to facilitate that innate healing response. And from here, when we are talking about this word Ayurveda, for some of you, it might be familiar, but just to make sure, this word Ayurveda is divided into two words, Ayu meaning life, Veda meaning knowledge. So the word Ayurveda can be translated as the science of life, the science of knowledge. It's prevention-based, and it is just all about, the focus is on whole person care. And one of the principles, there's many, is about balance, how to maintain balance. And you might be familiar or you might not. There's a principle of the doshas. Doshas means governing principles. There's 3 doshas, Vata dosha, Pitta dosha, Kapha dosha. And each of these doshas are governing certain aspects of the physiology. So these 3 doshas, Vata, Pitta, and Kapha, all govern a certain aspect. They're made up of the 5 elements from Ayurveda: space, air, fire, water, and earth. And space and air, the lightest of the 5 elements, make up Vata dosha. Pitta dosha is made up of fire and water, and Kapha dosha is made up of earth and water. These are some of, we call it doshas, or governing principles. They're governing that value of movement. So Vata is governing movement because of that air principle, movement, communication, transportation. Pitta is governing this value of digestion, metabolism, transformation, because it's more of that fire principle, very dynamic. And Kapha is governing the principles of structure, cohesion, lubrication. It's more of that earth principle. So it's the heavier of the 3 doshas. This understanding of the 3 doshas is something we focus on in integrative Ayurveda in so many different ways. So we always start at the level of consciousness, how to enliven that field of the basis from which everything emerges. And along with that, we also look at this balance of the 3 doshas. They are not only within the physiology, governing these different principles of movement, digestion, structure, but they're also expanded to everything in our environment, from the foods that we're eating, the spices, in terms of the times of the day. There are some parts of the day that are more Vata predominant, or Pitta predominant, or Kapha predominant. So Ayurveda gives so many different recommendations for which diets to favor, depending on that level of balance within one own individual's expression of Vata, Pitta, and Kapha. So there's different diets, there's different lifestyle routines. So not only that we know we should favor, having good sleep, a good healthy diet, good exercise, but also when to do those activities so we can maximize the benefits from those activities. All of that Ayurveda has given in terms of a wholeness, so that the individual always is experiencing that connection to their own self, as well as the connection to their environment during the different times of the day, the different seasons, the different stages and ages of life. This experience of wholeness, as we're moving through the relative changing fields, we're always experiencing this absolute field of consciousness, that field of inner intelligence, where that value of wholeness provides that ease, which is really that experience of health and wellness. So this is just a little bit of an understanding of this consciousness-based approach to health and well-being. And to expand on this, I'm going to turn it over to Dr. Leslie Elder, who will be talking a little bit more of the importance of diet and the experience of that digestion and how it impacts our health and well-being in terms of chronic disease. Dr. Leslie?
Hi there. Thank you, Dr. Shankri. I'm Leslie Elder. I'm trained as a family physician. I am going to talk to you now about the importance of digestion and the approach of digestion in treating chronic disease. In Ayurveda, how we digest our food is really everything. Improper digestion is considered to be the root cause of disease. With proper, there's a saying, a famous saying from Charaka Samhita, which is one of the seminal texts of Ayurveda. With proper diet, medicine is of no need. Without proper diet, medicine is of no use. And in the same way, with proper digestion, medicine is of no need. And without proper digestion, medicine is of no use. So you can give all the drugs and herbs that you want to a person with chronic disease, but if you don't have good digestion, you aren't going to get at the root. If the patient doesn't have good digestion, you're not going to get at the root cause of the disease. So optimizing digestion is the foundation of the Ayurvedic approach to chronic disease. So I'm going to just paraphrase a quote from Charaka. The nourishment and maintenance of the tissues of the body, immunity, strength, complexion, etc., by food depends on digestion and metabolism, because nourishment of body tissues cannot be produced by undigested food. So you've got the food on one hand, and then you've got the tissues, your body, and then in between there has to be digestion to connect the two. If you don't have proper digestion, it's just not going to happen. You're not going to be nourished. Your tissues, etc., are not going to be nourished. So there's two real key concepts to digestion. How do we optimize digestion for ourselves and our patients? And number one is Agni. Agni is the Sanskrit word for digestion. And here we see on the left, on the left of the slide, we see how the sun represents Agni in the universe. The energy from the sun is a source of growth, dynamism, and evolution everywhere in nature. And on the right, we see Jyotir Agni, the digestive fire. This represents Agni in the individual physiology, the digestive tract, digestive organs. Jyotir Agni is the source of all transformation, including digestion and metabolism of the individual physiology. So there's a real deep connection between our digestive fire, our Agni, and the sun, which is the Agni of the universe. We have this cycle of the sun, and we are not nocturnal. Human beings are not nocturnal. We're meant to be active during the day. The peak activity of the day is considered to be at noon, when the sun is at its peak in the sky. And this is when our digestive fire, all our digestive enzymes are at their peak, and they're ready, willing, and able to digest a large meal. So lunch should be the main meal of the day. This is when our digestive enzymes are at their highest levels. This is a key concept in Ayurvedic, in the digestion, according to Ayurveda. And this is how people traditionally used to eat until the Industrial Revolution. People went, away out of the home to eat. I'm sorry, and they left the home to go out to work, and they didn't get home till the evening. And so that has how the whole thing of large dinners started. That was when people came home in the evening. But really traditionally, and in more traditionally societies nowadays even, people eat lunch as the main meal of the day. And so it's the time of the day when we can most efficiently digest a large meal. As the sun goes down, our digestion becomes less strong as we're headed towards sleep. Our digestion is also going to go to sleep, but it's not going to be, it's still going to be active. And what it's supposed to be doing after 10 p.m., it's supposed to be cleaning up. It's supposed to be metabolizing and cleaning up taking care of all the byproducts of digestion. And it doesn't, that's not a good time to have a lot of food in your gut. And when you do eat food late, you might notice that it just sits in your gut. It feels heavy, hard to digest. And what happens is that this improperly digested food becomes toxic. In Ayurveda, we call these digestive toxins ama. So digestive toxins are ama, actually have an inflammatory effect on the body, producing disease. And there's been a lot of recent research about the role of inflammation in causing disease. And a lot of people are put on an anti-inflammatory diet, a special diet to reduce inflammation. But I just want you to know that the Ayurveda diet is the original anti-inflammatory diet. It's the whole purpose of the Ayurvedic diet is to reduce inflammation, reduce the ama, and reduce the products of improper digestion. So what is ama really? It sounds very mysterious. It's we think of it as the products of improper digestion, and it's actually a white sticky substance. You can actually see it on your tongue if you get up in the morning and you've had, maybe your diet hasn't been so great, and you stick out your tongue, and you might notice a white substance on your tongue. And if you scrape your tongue, you can do it with a spoon or a tongue scraper, you'll see this white sticky substance. This is like akin to what ama looks like. And for example, it's something, it's a sticky substance, and it can block channels, or shrotas in Ayurveda, and Sanskrit shrotas are channels. It blocks the channels in your body. So for example, coronary artery disease, the blocked coronary arteries, those are thought to be, that almost thought to be a component of those plaques that you see on the arteries. And the signs and symptoms of ama are heaviness. You might notice that heaviness in your body. It might be hard to get going in the morning. Indigestion, constipation, so blocked, intestinal organs, blocked colon, mental and physical fatigue. You're just not, it's like the channels are just clogged. So, and also, like I said, coated tongue. So oftentimes we'll have, if we want to see a patient's ama level, we can tell it by different ways, but a real quick way is just to have them stick out their tongue. And oftentimes it'll look kind of white and coated, and that kind of gives you an indication of what their ama level is. A healthy tongue will be pink and not have that white coating. So how do we keep Agni balanced and avoid ama buildup? Well, first of all, we want to promote a strong digestive fire, or Agni. In general, so the general principles that we tell our patients to do is to, first of all, to make lunch the main meal of the day. It's very important. And we will, if in our fellowship, we will completely teach you how to do this, how to make this a reality for yourself, and you can, in a way that you can also teach your patients. Favor warm, freshly cooked foods because they're easier to digest. Avoid cold or raw foods because they're hard to digest. We want to avoid leftovers because they're also hard to digest. Using digestive spices is more than just tastes. Digestive spices actually kindle your digestion and make the food easier to digest. Avoid heavy foods at night. Like I said, it's very hard to digest heavy foods at night, like especially heavy proteins like meat or cheeses or yogurt. Those things are best eaten in the main meal of the day during lunch. A snack or fruit mid-afternoon is fine, but avoid grazing. Just constant snacking is a real burden to your digestive tract because your body continually has to keep, starting up again and starting the digestive process again, and then doesn't have a chance to actually complete the process because you're continuously putting more food in. It has to keep starting all over again. So the grazing is not a good idea. Like I said, some fruit or a little bit of nuts in the afternoon. If you're hungry, is fine. And then again, no snacking after dinner is done, except for perhaps if you want to have a glass or cup of warm milk with a tea bag in it before bedtime as a sleep aid, or just to have a nourishing bedtime snack, that would be fine. But heavy snacking is not great after dinner. And whenever I see, watching TV, they're always showing all these food commercials late at night, showing pizzas and all sorts of very fattening, heavy foods. And I really feel sorry for people who are tempted to like order out, or get some pizza to eat late at night. Not a good idea. Okay, so let's look at this. Could you give me this slide on Agni? We're going to look into different types of Agni because every person has according to your body type, has a specific type of Agni. Sama Agni is balanced digestive fire, and this is what we all want. This is on the left of the slide, just showing a good, it's like you want your campfire to burn, it can really cook some food. Visham Agni, it's an irregular digestive fire, and the seat of Agni is dominated by Vata. Vata is airy and has an irregular quality. Tikshna Agni is sharp, maybe a little bit too sharp, acute digestive fire. The seat of Agni is dominated by Pitta. These are people who are Pitta constitutions could often have this type of Agni. Mand Agni, mild, dull digestive fire. The seat of Agni is dominated by Kapha. So how do we treat these different types of Agni? Oh yeah, so there are specific diets. This is just a wonderful thing about Ayurveda is that each person has there's just so much knowledge about how to treat the individual constitution through so many modalities, and diet is a big one. So the Vata balancing diet. So to balance Vata, which is airy and cold and moving, we really want to settle that Vata down. And the way that we do that is through sweet, sour, emphasizing sweet, sour, salty tastes. And also warm and oily food is very settling to Vata. For Pitta balancing diet, we want to favor astringent, bitter, sweet, cooling, and juicy foods. That's very refreshing for Pitta because Pitta needs to be kept cool, and not, sometimes the fire can burn too sharply, and we want to just settle that down. A Kapha balancing diet is astringent, bitter, and pungent. For Kapha types, we need to give them a heating and spicy diet. So that these are ways that we can balance those types of Agni that I mentioned by giving people these specific diets. So for next slide, please. Elimination of ama. So we want to really avoid accumulation of ama. So first of all, we really we want to avoid the causative factors, which I've already mentioned some of them. Just avoid overeating. Don't eat until the previous meal is digested. Lunch, main meal of the day. Have a lighter dinner. Avoid icy cold beverages and foods. Always when you eat, always sit to eat and focus on your food. Avoid emotional upsets during meal times. And best to have heavier foods at lunch, and dinner should be an easy to digest meal. So another way of eliminating ama is amapachana, which is digestion of ama. Amapachan, it says here. We call it amapachana. We use digestive substances like ginger, cumin, black pepper, fennel, other spices, hot water, and different preparations that we will show you how to make. Ginger pickle is really great to have before a meal to fire digestion. There's Ayurvedic special digestive herbs that we will teach you how to use for people who need it. Cleansing of the digestive tract. It's excellent when you wake up in the morning for really pretty much everyone to have a glass of lukewarm water with a little bit of honey, raw honey, and lemon juice stirred in there, and drink that. And has this very good scraping effect. The honey and the lemons are scraping for ama, really good to get rid of ama. And we want to be able to kindle the Agni. It's a very good thing to do when you're trying to get rid of ama, is to kindle that digestive power by occasionally taking a liquid diet and using ginger and spices and ghee, lemon juice. Then there's the premier ama elimination therapy, panchakarma, which is a wonderful thing to do. If you can do it once a year, it's fabulous. It involves a very amazing program of massage and eliminations that is great for cleansing deep ama from your system. So I think, so in summary, it's really all about digestion. You can take the slide down. Take the slide down. So, and it's all about digestion in Ayurveda. By taking care of Agni, the digestive fire, and making sure you don't accumulate ama, you really will have a head start in preventing and treating chronic disease in yourself and your patients. And Ayurveda really expands our toolbox as healthcare providers. Rather than just using drugs to treat chronic disease, with the knowledge of Ayurveda, we have a way of actually correcting the imbalance on the level where it started. And I think this is what every physician longs for, or every healthcare provider. You want to have something that really gets at the root of the problem and not just kind of give a little superficial treatment. In our program, we teach our fellows how to incorporate, how to optimize your digestion, and how to incorporate the Ayurveda diet into your life and help your patients to do so. We have cooking demos during our clinical weeks. We share time-tested ways of how to easily make lunch the main meal of your day for yourself and your family. It's amazingly easy, believe it or not. You'll learn healthy, easy, and fast ways to prepare main meals, how to use spices medicinally, and how to make slow-cooked medicinal ghee, and it's not hard at all, and how to prepare fresh lassi, fresh yogurt, and all of these. We'll give you lots of shortcuts of how to do this so that you can improve your own health and the health of your family and your patients. We're hoping that you'll enroll in our fellowship program. Back to Dr. Charles.
Beautiful job. Thank you, Dr. Leslie. So hang on. Okay, so Leslie was talking about diet and nutrition, and here's a great quote. Diet is anything that is taken in from any field of perception, through any sense of perception, any mode of mind, and any mode of intellect. So we've talked about the approach to chronic disease from the standpoint of consciousness, and the approach to chronic disease from the standpoint of digestion. And I'll just mention briefly the approach to chronic disease. We often tell our patients, we teach our fellows, that chronic disease is caused by overuse, misuse, or underuse of the senses. And so we can look at the top half of the slide. So for example, for sight, excessive use of sight, excessively gazing at brilliant objects, misuse of sight, looking at terrifying, shocking, deformed, or alarming things. For sound, excessively intense, loud sounds will wear on your physiology. Misuse of sound, listening to harsh words, harsh news indicating death and destruction, frightening and insulting sounds, and likewise for all the senses, smell, taste, and touch. For smell, too intense, too sharp, intoxicating odors, or exposing oneself to unpleasant, rancid, poisoned smells, and the like. So what we expose ourselves to, our senses, sight, sound, smell, taste, and touch, over time has a profound impact on maintaining health or on seeding chronic disease. So to summarize this discussion, the integrative Ayurvedic approach to chronic disorders, we've talked about 3 levels: consciousness, digestion, proper use of the senses. One thing that we tell our fellows is that our fellowship is really practical, and I was a frontline primary care internist for 3 decades and worked hard to over the decades to integrate this material into my practice. And given the practice setting I had, really as a matter of necessity, it was boiling things down to the most simple brass tacks to explain to my patients. And so you've learned tonight already some really fundamentally essential things for your own health and for your patients. The approach from consciousness, meditate. The approach from digestion, don't eat too much at night. Cook your food, eat wholesome food, have your main meal at lunch. The approach from the senses. Don't expose yourself to violent stuff, to violent media, to violent movies, to violent speech, to violent people, to violent film, to violent music. Soothing, uplifting, to preserve one's health. So we hope that this gives you an idea of some of the therapeutics that we use for prevention in Ayurveda. Now, one of the really profound things that you'll learn in our fellowship is the technique of pulse diagnosis and a series of other clinical tools in terms of your exam and your history to detect imbalance before it manifests as disease. And we see in this slide the 6 stages of the disease process according to Ayurveda. So everyone's patient's fine, perfect balance due to lifestyle, proper diet, some stress, some germ, whatever. A particular dosha starts to accumulate, Vata, Pitta, Kapha, step 1. And then that dosha becomes aggravated. You might start seeing some symptoms of Vata aggravation, anxiety, Pitta aggravation, anger, whatnot. Then that dosha, these doshas, they live in specific parts of the body. It starts to move. It leaves its home and starts to travel about the body, step 3. Stage 4, that dosha then localizes someplace it doesn't belong. Stage 5, disease manifests. Stage 6, disruption, serious disease. Now, the patient will typically come to us, the allopathic physicians, at stage 5 or stage 6. In Ayurveda, we have tools to detect the imbalance at stage 1, 2, 3, and 4, and to intervene before disease manifests. So, of course, we use our history and our physical exam as part of our toolbox. And then we learn the technique of Ayurvedic pulse diagnosis. According to Charaka, you can learn everything you need to know about the patient from the radial pulse. So that takes many, many years of practice. With the training you get in our fellowship, you can learn a lot about the patient and you can detect these imbalances in the early stages. And so we see here, so when we take the pulse, it's with 3 fingers. You take the pulse, and you'll learn all about this in the program. Just you place the index finger just proximal to the radial styloid, and then the middle and the ring finger. And each finger feels a different dosha. And so you can see here in the top slide, we have a situation where Vata, it's a little bit larger, Vata is starting to accumulate. And you can detect that Vata imbalance in the pulse at the superficial level. And if it's persistent over time, it might mean some imbalance. And you can intervene. If it goes unchecked over time, you can see here in the lower examples where the imbalance expresses itself deeper and deeper in the pulse and thus in the physiology and becomes more and more difficult to treat. But by detecting that imbalance early and then using these ridiculously simple yet evidence-based and extremely profound interventions, you prevent disease before it manifests. And this is really the promise that Ayurveda and integrative Ayurveda holds for modern medicine and for all of us and for rejuvenating our practices and our own health. So in our fellowship, it's 2 years, remote learning, asynchronous, you can study on your own time. except one webinar like this, an hour and a half, every other Thursday night, and on Zoom. And then we have on-site residential training 1 week each year, usually around the end of October, early November. Otherwise, you learn on your own, 10, 12 hours a week, about 1,200 hours totally. About half the program, half of the content is, the didactic content is Ayurveda. That material comes from us at MIU. We have many decades of experience and multiple degree programs teaching Ayurveda. The other half of the curriculum is quote unquote general integrative medicine. It's the Western approach to holistic care. We license curriculum for that from the University of Arizona. And at the completion of the fellowship, everybody gets an MS degree. And the MDs and DOs are eligible to sit the certification exam offered by the American Board of Integrative Medicine. So you'll get practical skills that you'll be able to use in your practice right away, right out of the gate. And those skills will grow, but very practically oriented. Diet, herbals, mind body, 5 sense therapies, pulse diagnosis, exercise, evidence-based referral guidelines for acupuncture, chiropractic, Chinese medicine, and the like, all very practical. And we are very focused on self-care. So the big emphasis on taking care of yourself. All of our fellows learn the transcendental meditation technique. We learn the yoga asanas, pranayama, the diet, the routine. And we learn by stabilizing the practice in ourselves, in our own health. That's the basis for our helping our patients and integrating the material into our practice. You'll be joining in our fellowship a community of like-minded people focused on learning to succeed and thrive in a busy clinical practice. So we're really eager to have you and your colleagues join. I will mention that for those of you who are already board certified in integrative medicine, we have a certificate program that allows you to enter this program. This is only for board certified physicians, that allows you to enter this program and just take the Ayurveda component. So we have some people who are interested in taking advantage of that. And we really look forward to seeing as many of you as possible in our program. At this point, we'll stop the presentation and take questions.
If anyone has
Yeah.
questions, you're welcome to add them to the chat, or you can raise your hand. Janice, do you have a question? Or anyone else have a question specifically? You're welcome to type it into the chat if you would like to. Here's a couple.
Okay, there are several questions about the tuition for the program. So the cost of the program is $9,000 a semester times 4. So the total cost of the degree is $36,000. This includes your transcendental meditation instruction, and it also includes the room and board when you come for your clinical weeks. Those are all provided as part of the tuition. Where do we meet on site? Fairfield, Iowa, Maharishi International University, Fairfield, Iowa.
We also have some questions about the practicality of how doctors or clinicians that can actually intersect this information with their practices?
Sure. So this is a really practical, this is a really practical program. So there are, you'll learn things that you can use in any practice setting. So some of the things that you'll learn are, you can tell anybody anywhere, don't eat too much at night. That's advice that's good for just about anyone that you can tell in any practice setting. So let's just talk about diet as an example. So you'll learn some very practical guidelines, practical to digestion, just as Dr. Leslie detailed. And then you'll learn some more specific dietary guidelines based upon the patient's state of Agni, Vata, Pitta, and Kapha diets. And Leslie gave you some general guidelines, but we'll also learn some very specific. I mean, you'll be able to give people menus, favor these foods, avoid these. And for people who are ready for even more sophistication, you can give them detoxification diets or purification diets and start with a few weeks of purification diet and then a dosha-specific diet. So there's very specific, the whole range of dietary interventions from very simple to very detailed, depending upon what your patient needs and your practice setting in any of the modalities. So the same can be true for the herbs. You'll learn a handful of very simple herbal formulas commonly available that you can use for lots of people. And at the same time, for a patient who is looking for and has the resources for and is able to comply with a complex herbal regimen, you'll have herbal protocols to treat different conditions based upon the state of digestion and the primary dosha. So again, a whole range of herbal modalities that you can use from very simple to very sophisticated, depending on your practice setting. 5 sense therapies, simple approaches to aromatherapy, music therapy, and it can be more sophisticated depending on the situation. And like detoxification, purification, reducing ama, really simple things. 24-hour liquid fast once a week. Sip hot water, or very more complicated home purification techniques, or you can refer people depending on your situation like that. So very practical. You can start using it right away in any practice setting, whether it's an integrated medicine consult service where you have carte blanche to do what you want, or if you're in a big organization, if you're at a big HMO like I was, or if you're in a big academic medical center and you feel restricted, no worries, simple things that won't ruffle anybody's feathers.
We also have several questions about the certificate and the difference in cost for that versus people that are doing both the integrative side of things and Ayurveda.
Okay, great. There's a bunch of questions. So the tuition for the certificate, if you're ABOIM certified, is exactly half. So you come into our program and you do everything. You come to the clinical weeks, you come to all the webinars, everything. But the way our program is structured is in a series of 21 courses over 2 years. And each course pulls in both general integrated medicine curriculum from the University of Arizona, as well as Ayurvedic curriculum. And you just skip the general integrated medicine curriculum. It's half it's half the tuition and half the amount of time, about 10 hours of study per week. Okay, that was from Seema. Okay. Anu, Dr. Vishwanath. Is the fellowship doable within 2 years for someone who is working full time? Does the fellow completing the program get a master's degree? Yes and yes. The program is set up specifically for people who are working. Most of our fellows, not all, but most are in active practice. And it specifically is set up to accommodate that. 8, 10, 11 hours per week. And everybody finishing the fellowship gets a master's degree. Who can join the fellowship? MDs, DOs, nurse practitioners, PAs, naturopaths, chiropractors, doctors of pharmacy, doctors of acupuncture, dentists. Right now, all of our fellows are MDs, DOs, nurse practitioners, PAs, or chiropractors. Those other categories are also eligible, and everybody gets the master's degree per American Board of Integrative Medicine guidelines. Only the MDs and the DOs can sit their certification exam. Okay. Can someone double major in the Ayurvedic Medicine Master's Program and Human Consciousness Master's Program? Wow.
Yeah, I would say that if I could just feel that one. So to do a double major, that's something that you would have to work with an advisor just to look at the hours of that. If it's a master's in Ayurvedic medicine, that's the MAVM program, there might be some overlap. And if you're doing a master's in the consciousness and human potential, there might be some requirements in the Ayurveda that already fit that. So you might not need to do all of the coursework. I would just check in with a person in the admissions office just to kind of go over that with you personally, depending on what your background is and maybe how to do that double major and the time commitment involved with that. And also just to answer Janice's question about how many hours of webinar per week, it is an hour and a half every other week during the entire course of the 2-week program. There's also breaks that are built in. So a winter break is there, a spring break is there. There's a half summer also, so there's breaks. So during that time, there's no webinars or anything like that. And the second question was, and does one practice pulse diagnosis prior to on-site training? We'll start with pulse diagnosis right in the beginning of the program and go deeper into that in the on-site training. So you would probably have about 2 months plus 2 months and a little bit of practice just online with the fundamentals and the concepts and learning it online. And then when you come in, for the on-site portion, we go much deeper with different exercises and also taking pulse with each other. And in the second year, that is expanded to taking pulse of patients. And so we'll go through an entire intake and, including pulse and also recommendations. But we start right from the very beginning and then it just expands from there.
Also, fellows are very much encouraged to take their patients' pulses if they're practicing, and their families and themselves. Very much encouraged, very helpful.
Dr. Vishwanath has asked, does board certification with the American Board of Pediatrics also get a discount with the tuition? No, the certificate program is specifically for those board certified in integrative medicine. Certification in internal medicine, pediatrics, no, just that one, because people who are already board certified in integrative medicine have already done that Arizona curriculum or the equivalent. One thing I want to clarify that's a little confusing is that MIU has 3 graduate degree programs in Ayurveda. One of them is this, and it's for the groups that I just mentioned, the licensed healthcare practitioners. We have a second program that Dr. Wegman referenced called MAVM, which is a 3-year online master's for people who are not licensed healthcare practitioners. If you're a licensed healthcare practitioner, you could take it, but generally the licensed healthcare practitioners come to this program. Other people, nurses, physical therapists, if you're from another field that's not healthcare related, you can still enroll in MAVM, which is 3 years. And then there's a third program, which is specifically an aromatherapy program. Why only MDs and DOs eligible to sit for the exam? That will be for, that's not us. Take that up with the American Board of Integrative Medicine. That's their rule. Now, it is common that most of the specialties that are incorporated through the American Board of Medical Specialties, the American Board of Physician Specialties, the American Board of Osteopathic Specialties, require MD or DO degrees. So I'm an internist, American Board of Internal Medicine. You got to be an MD or DO to be sit the boards. What about if a doctor is certified in the American Board of Integrative Holistic Medicine? So that is that's a different that's a competing certification that predated the American Board of Integrative Medicine. And Dr. Boris, if you wanted to pursue, if you email me afterwards, we could pursue that question a little more. We haven't encountered that, so if we can pursue that question a little more offline if you want to email me.
And just
here's
to
the
make sure
second question.
everyone, oh, sorry, I just wanted to make sure everyone has the email address for Dr. Charles. It was on the slide, but it's C Elder, so for Charles Elder, CELDER at miu.edu. Please feel free if there's any further questions to ask, and we're here to help support.
And I thank you, Dr. Weigman. I see that Dr. Evans is asking the same question. So both of you, if you want to pursue that, I don't know. This hasn't come up. It's a good question. And I don't know what the policy will be, but it's worth inquiring. Please get a hold of me offline. Any other questions? Okay. Hearing none. Thank you all for joining. Been very uplifting and enjoyable talking to you. And please contact me or any of us if you would like to discuss things, any questions, anything we talked about today, or anything that didn't come up that you'd like to bring up.